Tinnitus associated with audiology by accent. We are an audiology group affiliated with Accent Physician Specialists. So we're a specialty group of ear, nose, and throat physicians, endocrinology, and audiology. And we're located on the corner of Newberry Road and 43rd Street in the Millennium Center building. So we're going to talk about hearing and how it pertains to healthcare today. So let's get started. So we'll do a short anatomy lesson just to make it clear how hearing works, how we hear, all of that. Signs and symptoms of hearing loss. We're going to talk about noise and the impact that noise can have on your hearing. We're going to talk about tinnitus, or ringing in the ears. Tinnitus, or as some people say, tinnitus. Either way, the dictionary has the phonetic spelling of both. And then health conditions that are linked to hearing loss. So let's start with how we hear. The primary things that I kind of want to focus on with this slide is the three parts to the ear. So you've got your outer ear, which is the external portion, the part that you can see on the outside, and the ear canal, which is right here. So that's considered your outer ear. You've got your middle ear, which is anything behind the eardrum. So this is where the bones, the ossicles of your ear are. This is an air-filled cavity. So that is where, if you've ever had fluid buildup or an ear infection, that's where that's located. And then you've got your inner ear, and that's really where the sensory cells are. That's what sends the signal up to the brain. Here's the auditory nerve. So this is a nice little depiction. So it moves the bones, sends the signal through the inner ear and off to the auditory nerve. Ultimately, we hear with our brains. That's where everything is processed. So even though you might have some problems with hearing and understanding, yes, it's your ear, but ultimately it's how it's processed in the brain. So how the auditory nerve is processing the sound and what the brain is interpreting. So there could be problems with different parts of the ear that is disrupting the signal from actually getting to the brain and the brain to be able to process the signal. We're going to talk about the cochlea. So the cochlea is that little snail-shaped organ in our inner ear. And just to kind of go over this and how sound is processed, this says a lot about how hearing loss starts and how hearing loss can be perceived. So it's tonotopically organized, which means it's organized by pitch or by frequency. So if you think about this area here as the outer ear, this is the beginning of the cochlea. So the higher pitches, or the treble, is processed here in the base, and then it goes to the lower pitches through in the apex. This is important because many of the hearing losses we see, specifically with age-related hearing loss, it starts in the higher pitch range. And we're going to get into a little bit more about this in a minute, but that's because this is the first point of contact. This is where the hair cells in the inner ear start. If you've got a noise-induced hearing loss, that's typically at the first bend in the 3,000 to 6,000 hertz range, which is over here. So outer hair cells, these are important because these are the sensory cells that take the signal from the brain and how they're processed in the inner ear. So these are very susceptible to damage: noise, ototoxic drugs, poor circulation, and age. So you lose about 1% of the hair cells per year after age 21. So, it's a process. It starts early. So these are controlled by the brain. They actually provide amplification effects for soft sound. So these are moving hair cells, and when they hear a signal, they start to move around, they send the signal, and they send the signal by pitch, take the signal by pitch and amplify it accordingly. So this is what provides you with better hearing and noise. There are three main types of hearing loss. There's conductive hearing loss, sensory neural hearing loss, and mixed hearing loss. When somebody has a conductive hearing loss, that means that there is some sort of blockage in the outer ear. So this could be earwax, this could be an ear infection, it could be that somebody is born without an ear canal. That would be a conductive loss. So everything past that is working normally. So for all intents and purposes, the hearing nerve, everything else is normal hearing. It's just that if you don't bypass this outer ear space, then there's a blockage of that sound. Sensory neural is the most common. This is what we see with damage to the inner ear, age-related loss, noise loss. This is affected in the inner ear back here. And then mixed is when there's a combination of both. You could have a problem with the bones, you could have a problem with something going on out here, and also an inner ear issue. When you go to have your hearing tested, this chart is what you will see when you get your results. So this chart reads from left to right, low pitch to high pitch, like the keys on a piano. Really soft sounds to really loud sounds from the top to the bottom. You'll see these symbols on the chart. The red circles indicate your right ear. The blue X's indicate your left ear. This is an example of somebody with normal hearing. This line would indicate, anything above this line would indicate normal hearing for an adult. This is an audiogram with a hearing loss plotted on it. What I want to point out first in this diagram is the different levels of hearing loss. So at the top, you've got your normal hearing, you've got a mild hearing loss range, a moderate hearing loss range, and a severe hearing loss range, and a profound hearing loss range. So a variety of different levels of hearing. A lot of people think that hearing loss is defined by a percentage of loss. You can't really define a hearing loss that way because, as you can see on this chart, there's a different level here. So this part is within the normal range, and this part is within the severe range. It's very difficult to define this as a certain percentage. So we would define this as a normal sloping down to a severe hearing loss. Severe in the higher pitches, normal in the lower pitches. This is a very typical configuration that we would see with somebody who has an age-related or a noise-induced hearing loss. Now, in this chart, for example, the right ear is different from the left ear. There's a separation between the right ear and the left ear. That's usually a cause for a red flag. If you feel like one ear is not the same as the other, I would really encourage you to have your hearing tested. There's a variety of different diseases, disorders, problems that could be causing one ear to decline faster than the other. If both ears are going to decline, we would like to see them decline together. This is really important to show this because this is really where our soft consonant sounds live, right in this range here. Typically when you have a higher frequency hearing loss, these are the sounds that cannot be perceived unless somebody is talking to you very loudly and very clearly. This is a lot of the reason why somebody with a hearing loss like this can hear somebody talking to them but can't understand what's being said. Anytime you add any kind of background noise or group situation, it's going to be just exponentially more difficult. So we're going to go through some signs of hearing loss. A lot of these are pretty self-explanatory, but there's different areas that hearing loss can affect. So your social aspects. If you have hearing loss, you might require frequent repetition, have a hard time in background noise or group environments. A big one is thinking people sound muffled or that people are mumbling. That's usually a good indication. The hearing problem most of the time is noticed first by family members or friends. It's such a gradual loss if it's due to age or just a gradual progression that the person who's actually suffering from the hearing loss doesn't really notice it until it's more pointed out to them. They don't really know what they're missing until they get the treatment for it and realize how clear sounds can be. So they might have trouble hearing children and women. Those voices are typically located in the higher frequency ranges. They might have the TV or radio turned up. This is quite an issue with if you have a spouse, one spouse has good hearing, the other doesn't. The TV is blasting and they want to do something about that. You might answer or respond inappropriately to conversations. Have ringing in your ears. That's a big one. We're going to get into tinnitus in a minute. And you might read lips more intently. It could really affect people emotionally. You could be stressed because of the fact that you're trying so hard to listen and follow a conversation. It just requires a lot of effort to understand what people are saying. Your brain is trying to fill in the gaps of what you're missing. You could be annoyed because you can't hear or understand what people are saying to you. It could be embarrassing. You might withdraw from situations like social engagements or group dinners. You might feel nervous that you might miss something that somebody says. Medically, you can have hearing loss, and it can be a sign if you have a family history of hearing loss. If you have anybody in your family that has a diagnosed hearing problem, I would encourage you to have your hearing checked. If you take medications that are ototoxic, certain antibiotics, certain cancer treatments, those are all medications that can be damaging to the ears. Diabetes, heart circulation, and if you're exposed to very loud sounds or an explosive, you should probably get your hearing checked after that. So we're going to talk about age-related hearing loss. This is really the big one. I can hear, but I can't understand. So typically in the high frequency range, like I said, you can hear vowel sounds better than you can hear consonant sounds. So your volume's not really affected. It's more of your understanding ability. Your background noise situations are usually low frequency, so you can hear the background noise really well. It's just distinguishing words from that background noise is impaired. So ultimately, you're missing outer hair cells. You have less filtering of noise. It's harder to attend to a voice, and soft sounds aren't getting amplified as well for you. We'll talk a little bit about noise-induced hearing loss. It's a gradual progressive loss of the high frequencies with high-frequency sensitivity over time. It's the most common permanent occupational injury. So we're going to talk about earplugs in a second. And it's the only preventable type of hearing loss. So this is something that you can take into control of your own hands, especially if you work in a noisy environment or if you have noisy hobbies. These are some common noise levels. So you've got your really, really soft sounds like rainfall, whispering. Then you kind of progress to the higher levels. Surprisingly, one of the ones that always surprises me is a crying baby. A crying baby comes in at 110 decibels, which is the same as a motorcycle or a power lawnmower. So, if you're listening to a crying baby for a long time, just maybe take a step out of the room for a minute. So you just want to avoid a lot of these more noisy things. If you ride a tractor often, just wear hearing protection, or if you're going to be around loud sounds for longer periods of time. If you go to football games, wear earplugs. These are the limits for permissible noise. So this is kind of just the standards for occupational noise exposure. 90 decibel signal at 8 hours a day is considered what we would call damaging to your hearing. So that baby was 110? So don't listen to that baby for more than 30 minutes. Try to do something to make it better. Yeah?
Do I have permission to put headphones on when my baby starts screaming?
Yeah, put headphones on. Just make sure the headphones aren't blasting music into your ears, because then you're defeating the purpose. So here's some different types of earplugs. Got some here. So something like this. If you have really big ears or an elephant as a pet, you can use these. They come in all different shapes and sizes. There's ones that look like little dachshunds up there. I thought that was funny. The most important thing to take from this is if you are exposed to noise or worried about noise exposure in your life, make sure you have your earplugs in as best as you can. You don't want them sticking out like this. They should be all the way in your ear. If you hate the way earplugs feel in your ears, you can get customized earplugs. So we would make an impression of your ears, and you can get earplugs that look like this. If you have spouses that snore, those are good too for sleeping. Or if you like swimming and it bothers your ears, the water, you can get custom plugs like that to prevent water from getting in your ears. These muffs are real easy, especially if you do tractor riding or anything like that. Those are easy. These things cost like $2 at the store, so you can get a pack for like $5. So fairly inexpensive, and you want to protect your hearing, especially if you have hearing loss already. You want to protect what you have. So let's get into tinnitus or tinnitus. This is a sensation of noise, ringing, roaring, humming. This is how the Webster Dictionary defines it. People will say all different sorts of things in terms of tinnitus, and it's a very, very, very common thing. Does anybody in this room have ringing in their ears? Okay, good handful of you. So it manifests in many forms. Like I said, ringing, roaring, humming, buzzing, static, crickets, cicadas, hissing. I've heard all sorts of stuff. It can be tonal or pulsatile. So that can mean that it can be just a steady tone, or it can be to the beat of your heartbeat. If you've got ringing in your ears or any kind of noise in your ears that is the beat of your heartbeat, go to your doctor. That could be an indication of something more serious. Could be constant or irregular. Sometimes I'll just get it randomly for a couple of seconds and it'll go away. That's all right. It could be a mild distraction, or it can significantly reduce quality of life. There are people who it just absolutely drives them insane. So the tinnitus is not a disease itself. It is a symptom of something else. So it's an underlying health condition. In a majority of cases, it's just a reaction to hearing loss. But in some other situations, it could be something more serious. So it's always a good idea to go get it checked. Even if you could just get some strategies on how to deal with the perception of it, it never hurts anything. Be caused by hearing loss, a lack of auditory stimulation, so the brain fills in missing sounds, kind of like phantom limb syndrome. It's kind of just filling in that lack of auditory stimulation. It could be due just to an obstruction, earwax, foreign objects. Hopefully there's no foreign objects in any of your ears. Head or neck trauma, TMJ, which is something that would be treated by a dentist, sinus pressure, barometric trauma, or a brain injury. Could be caused by medications. Medications is a big one. Check the warning labels on your medications. It will most likely say tinnitus, but that doesn't always mean that you're going to get it from the medications. Or it could be a cause of another medical condition. So there's a bunch of them up here. So tinnitus can impact daily life. This is just an example of a random survey that people did. So most people find it annoying, but it doesn't really significantly impact their life. It's not bothersome to the point where it's driving them crazy. They could deal with it or they could ignore it. The best possible thing you could do for ringing in your ears is to avoid silence. You always want to have some sort of sound. I know that's the thing you're trying to achieve. Kind of a little bit of an oxymoron there, but keep something on in the background, soft music or anything just to distract you from listening to it. Here's some management options. General wellness, why we're here today, right? So diet, exercise, activity, keeping yourself socially active. If you're sitting home and listening to your tinnitus all day, that's never a good sign. So some stress reduction can help, relaxation. Hearing aids are one of the best treatment options if you have a tinnitus that is very bothersome. That can provide you back your auditory stimulation, treat your hearing loss, and help with the perception of your tinnitus. There is absolutely no FDA-approved medication that can reduce your tinnitus or make it go away. There's no cure unless it's some sort of underlying condition that can be cured in and of itself. So don't waste your money on anything that you see at the drugstore that says tinnitus relief or anything like that. It's baloney. So sound therapies are good, behavioral therapies like cognitive behavioral therapies, relaxation therapies, drug therapy. So I have that on there because most of the time what people will be treated with for tinnitus is actually antidepressant or anti-anxieties. A lot of times it stems from something like that. So no drugs to actually treat the tinnitus itself. So getting back to hearing loss, why is it so important and why are we talking about it today? It's pretty much a kind of fly under the radar disorder that nobody really thinks about. So it's ranked the number one communicative disorder, 48.1 million Americans, so that's 1 in 5. By the age of 65, 1 in 3 people have some degree of hearing loss. It's the third most common physical condition, only secondary to heart disease and arthritis. And it can affect anybody, all ages. Anybody can be affected by hearing loss. So, I would expect that in the future, we're going to be seeing more and more younger people coming in with hearing loss, especially with the music listening these days. So, job security for me, I guess. I don't know. Hearing loss affects more than just your hearing. So we're going to talk about how it's linked to other health conditions. Cardiovascular disease, depression, chronic kidney disease, diabetes, and Alzheimer's and dementia. So there's a big link between hearing loss and dementia. There's a study out of Johns Hopkins that pretty much concluded that the effort it takes for those with hearing loss to hear creates a regular strain that interferes with your cognition. So it doesn't mean that if you have hearing loss, you're necessarily going to have dementia, but it can actually increase the rate in which dementia happens. You could have an earlier onset of dementia just because of that lack of auditory stimulation to the brain. So with cognition, we always think about keeping the brain active, brain games, keeping our brains going. When you have hearing loss, you're missing some of that. You're missing some of that nerve firing, and if you don't use it, you end up losing it. So keep the brain active. If you have hearing loss, treat it as soon as you can. We'll talk about that a little bit. You withdraw socially from conversation and from social engagement. So a lot of times people will come in, we suspect they may have some sort of dementia, and they might, but they're not engaging in conversation. They're just kind of withdrawn. You treat the hearing loss, that social atmosphere just stimulates them, and they become more engaged in conversation. They do more things. So treating the hearing loss is very, very beneficial. The more severe the hearing loss, the greater the likelihood of developing a cognitive disorder. So here are some more impacts that hearing loss can have on a couple of different scales. So on your health, you can be fatigued, frustration, depression, anxiety, increased illness, impaired memory, so total diminishment of psychological and overall health. Interpersonal, so you could have misunderstandings, isolation. Some people come in and they say, well, you're not just my audiologist, you're my marriage counselor, because it causes a lot of stress between families and spouses. It could be a safety concern. If the hearing loss is severe enough, you might not be able to hear traffic or hear certain types of alarms. So it's important in a lot of different ways. So early treatment is the key to success. After the first symptoms, people usually wait approximately 5 to 7 years to talk to their physician. It's a long time. If you had an issue with your eyes, you'd probably be calling the doctor the same day and saying, hey, what can I do about my eye problem? 20% of people with hearing loss never talk to their physician about it. They just kind of deal with it and go about their daily lives. Only 34% of people with any degree of hearing loss wear a hearing aid. There's this stigma around hearing aids that they're terrible, they're big, they're bulky, they whistle. A lot of that is really just gone now. They're basically small computers. They make changes based on your environment. You can control them with your iPhone. There's a lot you can do with hearing aids these days. I'm going to pass out a couple of these so you can pass this around. You can get an idea of their actual size. They come in smaller sizes, they come in bigger sizes, but they've come a long way, put it that way. Of the 34% who don't wear hearing aids, 63 have a severe hearing loss, 63%, 52% have a moderate hearing loss, and 15% have a mild hearing loss, which is really, really surprising. So, this is a fun little comment. How many people in this room have been to their physician in the last year? Okay, good. How about the dentist? How many have had their hearing checked? 3. So it's a good indicator that it's just, not something people really seek out. Schedule a hearing test with your audiologist. It's not only good for you, you should share this information with your parents, your children, your friends, your family. It's never a bad idea to have a baseline hearing exam. Even if your hearing is normal, get your hearing tested. If something happens and you were to lose some hearing, you want to be able to compare it to something. Or if it starts to progress over time, you want to be able to track that progression. It could be something more that's going on in the underlying factors of all of this. So that's it. I'm going to open it up to any questions, and then we can do some hearing screenings.